Hi, I'm Nikki Conti, the Associate Director of Public Outreach and Education at the state's Health Connector. So the Health Connector is the state's marketplace, and basically we are here to offer health insurance coverage to individuals, families, and small businesses who need access to affordable and comprehensive coverage. This organization and programs really were put together to help fill a gap in Massachusetts for folks who are working in Massachusetts who didn't have access to some other type of coverage, either through employer-sponsored insurance, a partner's employer-sponsored insurance, etc. This organization for over 15 years now has been able to provide subsidized insurance coverage as well as completely unsubsidized commercial coverage to people where all individuals can compare and contrast plan offerings and then shop and enroll in the best plan that meets their needs. The Health Connector was able to make the shopping experience more transparent for consumers, and over the years has been able to improve this.
My name is Jeanette DeRoy, and I'm the Regional Shine Director of Bristol County. Applying for Mass Health is done simultaneously with Health Connector. They use the same website, they use the same application. And so that application can be done online. That is the fastest way to do it and most likely the simplest way to do that. You can do that as an individual by creating your own account or by calling the Health Connector number at 877-623-6765 or also calling Mass Health at 1-800-841-2900. They will go through the questions, make sure that you are giving them all the necessary information, and at the end they will tell you what documents they will need. And there is no open enrollment time period to do that, so if you're uninsured or you need assistance with insurance, you can do that any time of year. Mass Health is the first organization or agency that goes through the application because they are the fullest and most comprehensive coverage, primarily without a cost or a low cost. And that's really who we're trying to help and assist first. The Health Connector, those programs are also very affordable and made for people with lower income, but Mass Health has other more comprehensive coverage that may aid them even more fully than that Connector care. But they both have their advantages and really help people of all sorts.
My name is Cindy Phillips. I'm the director of the SHINE program, located at the Executive Office of Elder Affairs in Boston. The SHINE program trains volunteers and in-kind agency staff. We have over 500 sites that we cover. We try to make sure that there's a counselor or more than one counselor in every single city and town, so people have good access to information and services. We really value access. We have 88 bilingual counselors that provide access to 21 languages and dialects. Medicare is a program for people who are turning 65, have paid into Social Security for at least 40 quarters, and therefore they have assistance with their health insurance when they turn 65. It's also for people with disabilities who have had them and been deemed disabled at least 24 months. For people with amyotrophic lateral sclerosis or end-stage renal disease, they can get on earlier. So generally, it's age-related and disability-related. And if people have not paid those quarters in, then it opens up another interesting point. If they would have to pay for their Medicare A, which is the inpatient coverage, then they're not forced to go on to Medicare, they can go on to the Connector. And that's how the Connector and the SHINE program works together, is we have people who may be eligible for either one or may fall in the cracks, and we try to help them get the program that's suitable for them without risking any penalties or any expenses that they weren't aware of. Medicare has 3 parts and also contracts with Medicare Advantage plans. The 3 parts are Medicare A, which includes inpatient hospitalization, skilled nursing facility, home health benefits, and 3 pints of blood are not covered, but the rest is. Medicare B is outpatient coverage. That would include your doctor's visits, durable medical equipment, physical therapy, skilled nursing facility, and Medicare D are the prescription drug benefits. People have certain times when they need to sign up for Medicare A, B, and D, and if they don't sign up during a certain time frame, they may be penalized. So there's just a lot of moving parts within Medicare that people need to be aware of. What if you need outpatient surgery? What is that cost really going to be for you? What if you need chemotherapy? How much will you pay? Which insulin is on the Senior Saver Plan, and which companies are paying for that or helping to moderate your insulin costs? You know, it's really helpful to have people who don't have a stake in what you choose to help lay out your options. You know, it would help you drill down to that link to find out what that really means. And that's what the Shine counselors do.
So the Health Connector has lots of standalone shopping tools that somebody can use before they even enter or complete an application, where these standalone shopping tools let someone enter their own preferences. So let's say if someone has a particular physician or provider that they want to keep a relationship with, they can enter that information in, as well as, let's say, a particular facility that they want to make sure they can go to in case of emergency, or if someone has a particular medication that they want to be sure that is covered in their plan. When someone is looking for health insurance coverage, I think one of the first things that they need to consider is whether or not they want to find out if they can get some help paying for their monthly premiums. So on our website at mahealthconnector.org, there are tools that someone can use to put in some general information about themselves, their household, and find out which type of application they need to complete. There is a subsidized application, which is a little bit longer for someone to complete, and then there is a separate application if someone knows that they're not going to seek any help paying for their premiums.
One thing I'd like people to know is to not be afraid to apply for any reason. Whether you're afraid because of your immigration status, or you are afraid you think you're not eligible, don't let that stop you, because you may be eligible for something that will assist you. Go and apply and see what you're eligible for. It's better to have someone assist you, an application counselor, than doing it by yourself.
My best advice for people who need to make some decisions: open up that annual notice of change from your own health insurance plan. If you open it up and there's something there that's confusing, or it looks like it's changed in some way, or it no longer covers your medications, or your provider is leaving, then it's definitely time, if you feel comfortable, to go to the Medicare Plan Finder, type in your prescriptions. If that process seems a little bit confusing the first time or the 10th time, which it can be because the Plan Finder changes annually, do feel free to contact a Shine counselor. You can contact them by calling 1-800-243-4636, or you can call your own town's council on aging.
I've been doing this for many, many years, and before there was just Mass Health. And to know now that there is insurance for everyone, whether it's a young person who's working but doesn't have insurance offered to them, or not affordable insurance through their employer. There's so many different variations that people weren't eligible before, and now it's out there for people. So it's wonderful to see the changes that have taken place over the years and made it easier for people to apply.
We want to keep this process as simple as possible so that health insurance is just one part of someone's life, and that they can feel a little bit more comfortable at night. Like one less thing to worry about, having their health insurance coverage in case they need it whenever they need it.
This is complex information. It changes as people age, as their situations change. There are all sorts of transitions that people go through. It is very satisfying for me personally to know that what we're doing is meaningful, that it does help people. And so many counselors feel the same way. They get a lot of gratification out of doing the work.
It doesn't stop with insurance. It doesn't stop with saving them money. It goes a long way in really caring for them as individuals, their health, their families, just the stresses of everyday living. And sometimes heart-wrenching to see them through their development in different ways, whether it's up or down. But they come back and they tell us their stories, and it's a wonderful privilege to have, to be able to help these individuals and not just be pushing paper at people, but to really get to know them and help them.
To take this course and learn about others, click on the link in the description and subscribe to this channel.